What is glomerulonephritis? Well, first of all, I need to tell you what a glomerulus is, and that's one of the tiny sieves or filters within the kidneys. These tiny sieves or filters filter the liquid in the blood, the plasma, as a first step in forming urine. There are about 1 million of each of these glomeruli or tiny filters within each kidney. Glomerulonephritis itself is a medical term for inflammation of glomeruli within the kidneys. And how does glomerulonephritis show itself? Well, it can show itself in a number of ways. If a doctor or a nurse tests the patient's urine, they may find blood or protein. Alternatively, the patient may themselves see visible blood within the urine, or the patient may see frothy urine and have noticed swelling of the ankles or legs as a consequence of a heavy loss of protein within the urine or a protein leak. Glomerulonephritis is important because it can cause kidney damage, high blood pressure, or other complications. What are the causes of glomerulonephritis? Well, there are many different causes of glomerulonephritis. Most relate to some form of problem with the body's immune system. In these conditions, the immune system attacks the glomeruli or sieves within the kidneys, which of course does not happen in normal kidneys or in health. The key event that provokes this attack is often not able to be determined by medical science, but sometimes can be something such as an infection or use of a particular drug. However, as I've said, in most cases, medical science cannot identify the precise triggering event. In these conditions, the immune system will attack and damage the kidneys over time if not treated. Glomerulonephritis can cause high blood pressure or hypertension. And normally the kidneys remove excess salt or sodium from the body and get rid of that excess within the urine. In glomerulonephritis, the underlying condition provokes the kidneys to retain more salt or sodium within the body and reduces the excretion of sodium in the urine, and that in turn causes high blood pressure. That high blood pressure can be treated with a low salt diet, of which I'll discuss a little more later, and it also can be treated by pill treatment. The sort of pills that might be used include water pills to help the kidneys to excrete more salt or sodium in the urine. The treatment can also include other forms of blood pressure pills. The treatment for glomerulonephritis depends on the cause. So typically, a kidney specialist or a nephrologist would investigate the patient for that cause. So that would usually involve obviously the nephrologist or kidney specialist seeing and assessing the patient and then carrying out tests. Those tests would include such things as blood and urine tests, scans of the kidneys, and potentially may include a kidney biopsy. Treatment is aimed at correcting or limiting the underlying cause of the glomerulonephritis and also treating any complications. If the glomerulonephritis is due to an autoimmune condition where the immune system is attacking the kidneys and the glomeruli in particular, then the nephrologist may advise on immune suppressing or immunosuppressive treatment. This can include drugs to suppress the immune system and reduce the attack on the kidneys, for example, using such things as steroid medication, usually taken as the form of pills. So, with regards to diet for kidney conditions and glomerulonephritis specifically, typically the nephrologist or kidney specialist would advise cutting salt. We have many sources of salt in our diet, and obviously the kidney specialist, such as myself, would advise avoiding use of all table or any other form of salt. It should not be added to cooking or to food being prepared. And most of our salt actually comes in processed food that we buy from the supermarket or other shops. So we would advise that the patient avoids processed foods high in salt, for example, ham or bacon and other processed or cured meats. Also, many ready prepared meals will contain high levels of salt, and many takeaway foods or restaurant foods can be high in salt. So instead of eating these, we would advise the patient to eat freshly prepared food made at home without adding any extra salt. There's a lot of information on the internet about this, but for example, in the UK, a charity called Action on Salt, that's all one word, actiononsalt.org, gives further information on foods that are high in salt and alternatives to take. There are no specific foods that would cure glomerulonephritis, but a diet that is what might be regarded as a healthy eating diet is certainly helpful. For example, a diet high in fresh fruit and vegetables. Thank you.